Go ahead and start. Again, good morning. Today's February 3rd, 2026, this Tuesday. And present with us now is the County Health and Nurse Supervisor, Ann Hannah. Would you like to start us off, please?
Thank you. So we just kind of rolled over a year, so I thought I would print our December snapshot from 24 and from 25. I know I've sent these out to you, but just seeing them together kind of gives a comparison. One thing I've noticed on here is that we did give fewer vaccines this year than we did last year to fewer patients.
What's the percentage difference? I mean, is it a lot or just a little
Figure
bit?
the percentage.
Or
Last year,
just
we gave 1,149 vaccines to 689 patients. And this year we gave 975 vaccines to 605 patients. So we did see a decrease in COVID vaccines this year. And we did see a decrease in child influenza vaccines. So those are kind of areas that we'll look at and kind of see what we can do. But I think, these are kind of good things for us to look at. But these were the ones I can leave these for you to look at. The good news is we had fewer outbreaks in our congregate settings, so that's good news. Part of it is reclassification at the beginning of the year last year and when an outbreak was in long-term care, so that would account for some of it. They kind of loosened some of those guidelines a little bit. Before, it was anytime they had one case of COVID, it was called an outbreak, and we kind of did a little bit of metric on what that looked like this year instead. So that's some of it, but this makes me feel happier that we're seeing less outbreaks and folks that, are in a place where they are significantly impacted. So one thing that we talked about in our staff meeting today is that due to the changes with environmental health and having a contractor, some of these environmental health statistics might be harder for us to get a real handle on than they have been in the past. So we're looking at ways that we can still be working on that, because I do think that these numbers are important. These go out to quite a few people as far as community partners. And I know I've gotten feedback from people that they appreciate it, but it also gives us data to look at. So those are those. We are seeing, we saw a bump in COVID or in influenza a couple weeks ago. We saw it kind of drop a little last week, and we're seeing cases again this week. One of the things that we're seeing this week is that we have had our first cases of influenza B. So before that, all the cases were influenza A. And it's pretty typical for B to kind of creep in later in the season, and that's what we're seeing. So B is a different strain, so it's, has the ability to impact different people. All of the people that have been diagnosed with influenza have been throughout the county. We've seen it from one end to the other, and they've been all ages. We've had it from infants clear up to our senior population. So it seems to be non-partial to where you live or who you are. It has been a little bit of a rough flu season across the state. Last year was probably one of the hardest ones we've seen in multiple years. And part of that was the number of hospitalizations, and we had 68 deaths last year due to flu throughout Montana.
Okay.
So we are looking at that. The state contacted me. They're kind of looking at changing the metric a little bit on how we're getting reports of those flu cases, which I'm not sure is going to be the best for being able to know things like what I just told you, because we won't have all of the lab reports. And that means we don't know who those people are. We're going to know if they've been hospitalized or if they're deceased. So, they haven't made a decision on that, but, that is something that they're looking at.
When do you know your flu vaccines are more effective or less effective? Aren't you kind of shooting in the dark?
One thing that is advantageous to us on the northern hemisphere is that the same vaccine is given on the southern hemisphere before we receive it.
Mm.
And so we can kind of look at how, we usually look at Australia. How did it do in Australia? And we can kind of gauge a little bit, but we know with flu that it migrates all the time. And so, it's constantly changing. We feel like last year's vaccine didn't match the virus as well as it could have, or we don't have all the studies yet for this year.
Okay.
So that's some of it, but we are seeing some vaccine hesitancy. We are offering a caravan clinic this Wednesday, tomorrow, here. But any vaccines we give in any of our clinics this week would be covered by caravan. And that's a huge thing because they're no cost.
Okay.
So we're going out to Yellowstone Boys and Girls Ranch. Whenever we get the van, we go out there. So we've got a few vaccines we're doing out there, and then we'll be at the Boulder Clinic from 3 to 6 tomorrow. So if there are folks who haven't gotten it, we're trying to get the information out that it's no cost. Insurance is billed, but there's no cost to the patient. So it's a good time. We did use all of our flu block vaccine that we ordered this year. So that's the ones that we as preferred for 65 and older, that the CDC recommends as one of the 3 for our older population. And we did administer all of that. So I'll probably do a breakdown of those numbers of who came in and how many we did. We can run that kind of a report from MTRAX, the state's database on immunization, and kind of see where we're at. If we do some of that looking about this time of year, because this is when we order flu vaccine for next year.
Mm-hmm.
So what we haven't administered is, that we give for younger folks. So we're seeing less uptake there. And we're seeing a lot of illness in the school right now. Clancy School had almost 20% of their population sick yesterday.
Wow.
So we sent out letters to all of the schools and all of the daycares, kind of telling them what we're seeing, kind of giving them some guidance on prevention and giving them guidance on respiratory illness and when to stay home and when they can return to kind of slow that spread. I also know that Jefferson High canceled their high school basketball practice last night due to illness. So we have a cross-county game scheduled on Thursday, which means all of Whitehall will be in this gymnasium that day. So I'm like, see what happens in 2 weeks. So that's what we know. We also had 5 cases of COVID that were reported last week. So we do know that COVID is out and about. We've seen varicella cases in a couple of the counties in Montana, including Lewis and Clark. So that is a vaccine preventable disease. So it hits our radar. Fortunately, there's been no measles in Montana for a while, but there are still 36 cases that have come in the last year. So that's not our best news either. I think that's kind of our communicable disease update. We are going to participate in the after action report that Doug Dodge is hosting at his LAPC meeting on Thursday for the power outage event that we had in mid-December. Jesse and I have been looking at that and seeing what we can contribute to that after action. Because it's held at LAPC, I'm not sure if all of our partners will be involved, but we'll provide some feedback on that. One of the things that Jesse and I have identified as we've been talking internally with our staff is that the health department has 4 generators. We've got one on the I think we have two on the south end because Jefferson Valley Search and Rescue uses one of them. And then we've got another one and we've got one on the north end and we've got one here. So they're in our sheds. We call them our FEP sheds, but they're in our sheds. They haven't been well maintained and they were not used during the outage. And so that was one thing I asked Jesse is, what can we do with these? If we're gonna have them, we need to have them maintained. And if we don't have a use for them, is there someone else that would? And so we've kind of been thinking on that thought process for the last few weeks. And what we've come up with as a proposal, and I wanted to run it by you guys, is to keep one of the generators, the one we have here for our use. One of the big things, and I was traveling during this outage, so my concern was, what are we doing with our vaccine? Because we have thousands of dollars of vaccine that's got to stay at a certain temperature. So we do have a plan for that, and we executed that plan. One of the things we bought with that extra funding from the state FEP department were some other coolers that we can store vaccine in that holds it at temperature longer. So what we usually do is put it in the sheriff's department because they have a generator, but then we can't keep eyes on it very easily. So we've got these other coolers now where we could keep them in our possession for up to like 100 hours.
Okay.
So that's gonna increase our ability to really watch that vaccine. So I don't know that we would need the generator for running our fridge. We've never used that. It's not part of our plan. But it would be nice for if we do offsite things to have access to a generator that's maintained. Jesse said it would be approximately $150 for us to do the upkeep that's needed on it. And I do have that in my FEP budget to do that. So our other idea is to reallocate those other 3 generators so that they're being used. We feel like if Jefferson Valley Search and Rescue is using the one, to leave it in their possession.
They've got generators,
Do they?
so I would take it.
Okay. And then the other person that really kind of came up and Jesse talked to was Bear, because they weren't able to get gasoline. And so they could run their pumps for gas with the generators that we have. Jesse and Bear have talked to it. So we thought that it would be good to rehome them there. But I said, is that going to create any equity issues if we've just decided to give it to one entity? So that's why I'm kind of asking for your guidance on how or what is appropriate to do with that kind of a situation.
That's my question I'd ask on the generator is, one, if I'm not mistaken, because I've seen it last, it's locked up. It's propane, right?
They're propane.
Yeah, I've seen the ones we've got are.
Yeah.
gasoline. Well, I'm no longer search and rescue, but they've got 2 generators.
Okay.
So yeah, I think you'd be more somewhere else.
Do you know how many wattage there are?
I don't. Jesse would be the one to give you the detail on them. But it's just, I mean, we haven't promised to anyone. It's just been an internal discussion. But my thought is I'd rather have them used than sitting in storage and deteriorating.
Well, do you think if you would have been here, or if this power outage would have lasted another day, that you would have needed it over there? I mean, I don't know what you do in your office that would require.
I think one is sufficient for us.
Okay.
I know these were all purchased by Noel when he was the supervisor, and in the 14 years I've worked here, we've never used them.
Because the nice thing about the propane ones, they don't take much service. The gas doesn't go bad in them. You
Yeah.
shut them off, everything's gone, so they'll stay. Besides changing the oil once in a while,
Yeah.
they're in good shape, so. Probably propane is
And
great, but
starting them up, make sure they run.
And I
Yeah.
think I think it totally depends on what the emergency is, who would need it. I mean, if it wasn't power, if it was something else that happened.
Well, that's why
Obviously,
I'm asking.
There were I mean, you and the road crew in your office were one of the few that worked during that outage.
Right,
So it makes sense that they should be able to have access to what they need to do their
Their
job,
job.
as the same with you. Who else really needed one? But I
Yeah.
think it could be incident specific.
Might be,
no, I
might be a good
agree.
conversation for this after action thing where, you know, whatever departments maybe needed something like that, but didn't have them. You know, if you got some extras that we could reallocate, that might be good, but I would probably keep one. You're thinking
We're
about
gonna
keeping-
keep the one that we have here.
Okay.
It is key operated,
Okay.
the others aren't.
Okay.
So it would be easier for any of us to use than the other ones. So we've kind of looked at that. The other thing that I'm really looking at and thinking about is as we look at building expansion is maybe to put solar panels on our building with battery packs.
See if
And
we got
that
some
might,
backup power.
you know, because the other thing we might need to do is have access to our computers. That would be another thing that we'd need to be running to be able to. And as it was, you know, Jesse was in Helena and had power, and I was in Salt Lake and had power.
Mhm.
Now Butte didn't lose power either. So if I'd have been at home in Butte, I'd have been okay too.
right.
So like I say, it is situational, but you know, looking at other options, you know, the things we would need power for are our vaccines to keep them cold. And, you know, possibly our, you know, computers if we're needing to be on them doing disease investigation or, you know, something like that.
Do you know if Noel put in the connect on the building for that generator? Where the generator will hook into the building?
Yeah, I don't.
Okay.
This is just like,
I don't think they were, because the sheriff's office had access to one too. I don't know where it ended up. But there was one over there. That was a long time ago.
yeah,
And it's all the propane tanks hooked right to the cart. He bought carts with them and they're all like one piece.
So what we could maybe do with that building expansion is design that for, solar plus the generator. We can actually put a new panel out by the other panel where
The ambulance
your
service that had
generator will connect right in and then you can pick what you want to have powered up.
well, I really think that if we're putting time and money into this building, that we make it work in the case we have an emergency.
Yeah.
You know,
I think it would be great. We just have to see what size of generator it is,
Yeah.
because if it's a small one, then it's only gonna maybe run your refrigerator and your computers.
well, we've always had it just, if the thought we could run the refrigerator,
Right.
you know, we've got, I don't know what we'd need to do for the computers.
Yeah.
And
that
it would also depend on how many of them we needed for any.
Right.
But
You know.
you can do that. You can
Isolate circuits.
isolate certain circuits.
Mhm.
Because when the sheriff's office had their first generator, it only ran the jail and
Mhm.
certain plugins in the sheriff's office. And when we put a new one in, when that one got hit by lightning, we made it run the whole thing.
Mhm.
So you can kind of pick and choose what you want to run and not run.
Right,
It could be the plug-in for your refrigerator, it could be the plugins for your computers and your lights, and everything else is,
it's down. Yeah,
I mean, it would, but if you're going that far, you might not have to make every plug-in work, but you'd want your heat to work, you'd want your
Right.
refrigerators to work.
and you'd want some access to computers. Well, it's just, I mean, like I said, it's just a thought that I've been chewing on ever since this outage. And, you know, it seems like kind of opportunistic time to look at that if we are gonna do something with the building. Because if people are involved, public health would be involved in any emergency.
Right.
That's what we do, so.
And it might have been a good facility. I don't know. When we get it set up, if there's a conference room or something, people could come in and warm
Do a
up and charge
charging,
their phones or whatever, just have a spot to do that. I know sheriff's office did it here, but they didn't have any. It was just outside on the
Right.
trailer, so if it would have been cold, that would have
Right.
worked.
And then, you know, the other thing we're working on with the state is purple air monitors. So we actually have, Whitehall has a purple air monitor at their school. Jefferson High just got one, they're hooking one up. Clancy and Montana City are both looking at getting one. So we basically have purple air monitors throughout, and we started an education campaign this spring before wildfires start. But, you know, the other option would be a clean air space where people could, you know, we could be a clean air space, not that we'd be open all the time, or that, you know, we're looking at libraries for that too, because, you know, they're a public place where people are welcome.
Sure.
So those are some of the projects we're working on now. I think a lot of it kind of stems from
Let's
some of
go,
this
sure.
emergency stuff. Anyway, those are the big things on my mind right now.
What's purple air?
Purple air are air quality monitors for wildfire.
Okay.
And, you know, I mean, Doug just sent out a thing today that they're doing a prescribed burn. I think we're gonna be
Yeah.
seeing more of that. Just because of the health of our forests
So
right
smoke
now.
in the air and stuff like that.
Right. So we're looking at being, I mean, right now we rely on Helena or Butte or, you know, these other, which our air quality could be totally different. So if we're looking at if we can get these air monitors in, you know, specific locations, and then they get them hooked up to the sites that report that, like Air Today or whatever, then our people could be looking at air quality, and we could be monitoring the health risks, which health is why I'm looking at it. But they are doing some statistical data that shows Montanans have some chronic conditions that are impacted because of the amount of wildfire smoke that we are exposed to.
Mhm.
So it's just kind of another public health thing we're looking out for. And it's a good partnership with our schools, you know, to be able to work with them on a positive thing. So that's what we're doing. Any other questions?
It's sort of like your idea of wherever you might put that generator. I'm thinking, I already thought in my mind where you put it down in my home, more so than where it's at, but I mean, we'll talk about that come at the LEPC, but in terms of the community center or someplace there, or someplace that could have been utilized, or any of those places
Yeah.
on the outside there.
When we did our outreach to our long-term cares, because they were the ones I was worried about, and our schools, it was only one that said, we have a generator, but we don't know how long it'll last or how much, you know, if you had a generator, which that comes into an equity issue too. You know, I mean, if all of them need a generator, how do we decide who gets it? So anyway, that was the other thing we're thinking, well, why do we have these and how are we using them? And so those have been the discussions around them.
I just thought a neutral place, you could keep it and going, okay, we're gonna need it here, let's,
Right.
here's where it's at, give it to those.
Well, and I think that was the intent of getting them in the first place, is to be able to share them with the community,
Right.
but there's never been a real plan
No,
or
you're right, it's just
protocol.
sitting there, so.
And like I said, in the 14 years I've been here, I can't remember them being used.
I don't either.
So
Mhm.
let's figure out a way to use them, you know, effectively.
Right. If nobody's using them, whatever you do is a benefit. I think.
Right,
And I agree.
right. But like I've said several times, I worry about the equity piece of this. How are we determining these things, and how are we, you know, being inclusive and equitable to everyone who needs it? You know, I mean, yeah, we look at risk most likely, and we would look at that, or maybe it's a first come, first serve thing. If you ask, you get it, you know, if as long as everybody knows that we have it. So those are just things that go through my brain.
Yeah, I think most emergency services are gonna, especially after this last event, are gonna prepare for that, have their own generator or whatever. They're not gonna rely on us or the health department or whoever to have a generator sitting there when they need it, so.
Well, and it's not really our job to supply everybody.
Right.
It's our job to educate them
Yep.
to be prepared. I feel that's
Oh,
my job.
absolutely. Yeah, we were lucky enough that Helena and Butte and everywhere around us had power, so everybody just
And
kind
it
of
didn't
dispersed.
get as cold as it
Right.
could have.
Yeah.
I mean, if it had been a below zero
Yeah.
stretch of time, we'd have had some different outcomes.
Absolutely.
So, you know, and I know one of our facilities lost some food because their refrigerator got too warm.
Yeah.
So, you know, it's a good wake up call for everybody in that, you know, how do we prepare for next time?
Yep, absolutely. It was a good training event, if anything.
Yeah, it was. That's how I'm looking at it too. Woo-hoo. This one came out as a good experience.
We are good if
We're good.
anybody else has
We'll be
anything else.
adjourned. Okay, I'll
We'll be
stop,
adjourned. Thank
stop the
you.
recording.